Blood collection, dermal puncture collection. What is dermal puncture? Although venipuncture is the most frequently performed phlebotomy procedure, it is not appropriate in all circumstances. Current laboratory instrumentation and point-of-care testing make it possible to perform a majority of laboratory tests on microsamples of blood obtained by dermal puncture on both pediatric and adult patients. In most institutions, dermal puncture is the method of choice for collecting blood from infants and children younger than 2 years of age. What are the materials needed for dermal puncture? First up, we have lancet, next alcohol swab, next alcohol, capillary tubes, cotton, and bandage. What are the procedures for dermal puncture? First, assemble the necessary equipment: the lancet device, alcohol pot, dry gauze, slides, and capillary tubes or other supplies necessary to receive the blood. Procedure 2. Be sure that the patient is seated comfortably. You may also proceed to patient identification and make sure that you had already washed your hands and put on your gloves. Next procedure, choose an area for the puncture that is free from calluses, edema, or cyanosis. Warm the puncture site if it is cold by immersing it in warm water or by rubbing it. Next, clean the skin of the puncture site on the third or fourth finger vigorously with a pad soaked in an alcohol solution. This will remove dirt and epithelial debris, increase the circulation, and leave the area relatively sterile and allow the area to air dry. Next, grasp the finger firmly and make a quick, firm puncture about 2 to 3 mm deep with a sterile disposable lancet or automated lancet device. This puncture should be made at right angles to fingerprints striations on the patient's finger, midway between the edge and the midpoint of the fingertip. The puncture should not be made too far down on the finger and should not be too close to the fingernail. A deep puncture hurts no more than a superficial one, and it gives a much more satisfactory flow of blood. Next, discard the lancet in the sharps disposal container. Used lancets should never be left lying on the work area. They should be discarded immediately after use and should not be touched again. Next, if a good puncture has been made, the blood will flow freely. If it does not, use gentle pressure to make the blood flow to form a round drop. Excessive squeezing will cause dilution of the blood with tissue fluid. Collect the specimen by holding a capillary tube to the blood drop. Rapid collection is necessary to prevent coagulation, especially when several tests are to be done with blood from the same puncture site. When the blood samples have been collected, have the patient hold a sterile dry piece of gauze or cotton over the puncture site until the bleeding has stopped. And lastly, don't forget to remove your gloves and wash your hands. That's all for blood collection dermal puncture.